Hi, I'm Dr. Amee Daxini from Think Skin Clinic on Sarjapur Road. Another, important, armamentarium that we have for anti-aging is the dermal filler. It is amazing. I mean, I'm personally in love with this product. It's nothing but hyaluronic acid. It is artificially synthesized, of course, but the good part about it is it replaces the hyaluronic acid which is lost with aging. So this synthetic hyaluronic acid is stabilized and it's tested. So it never causes allergenic reactions at all. The other good part about fillers is that they give you that natural look which you need, provided again done by the right doctor, either a dermatologist or a plastic surgeon. Anybody can take a dermal filler provided their blood sugar is under control, and we prefer to give antibiotic treatment, especially if they are prone to developing infections or have dental treatments taken at that time. So dermal fillers generally are injected in areas where there is a depression. So basic difference between botulinum A and dermal filler is that filler is like filling a cushion with cotton. When the cushion actually becomes flat, you put extra cotton to give you that kind of shape and make it look plump and soft. Whereas botulinum A relaxes the muscle. So the lines which are present when you use the muscle is when we inject botulinum A. But the lines which are present, the grooves which are present even at rest is where we inject the dermal filler. That's the basic difference. Now dermal fillers are injected generally by local anesthesia. Just apply a cream and you inject dermal fillers. Nowadays in the Indian market, we've developed dermal fillers which have an inbuilt anesthetic cream in it, the anesthetic agent. So we directly inject and you can walk out in 15 to 20 minutes. The areas which respond best to dermal fillers are the mid-face. When you know that your face is sagging, from the inverted V it's actually become a square. When you notice that the cheekbones are not as high as they used to be. When you notice that the lines here are far deep, the thickness of the lips has reduced and you notice they've become thinner and drier, that's the time we generally inject dermal fillers. So the best response is mid-face and the lips. You can do the chin. We work on the nose and the nasal bridge. We also work on the temples, especially in aged women, after 55 and 60. When you notice that this flattening of the temple area is where dermal fillers are injected. So it generally is used in combination with the botulinum A and other anti-aging procedures to give you the complete facial makeover. This is one of the dermal fillers. I just want to show you how it looks and how we inject. It comes in a gel format in a needle which has markings, so we can exactly inject the amount that is required in the place. It comes with very fine needles which we attach to the syringe. They're all completely sterile. We attach it to the needle, and this is a very tiny needle. These generally have an inbuilt anesthetic in it, so you don't need local anesthesia. We directly inject it into the area of concern. It's like a gel. It replaces the hyaluronic acid that has been degraded due to aging. Another question asked by most of our patients is that, will I look unnatural? Will people talk about it, or ask me what I've done? If done in the hands of a right doctor, you will just look amazing. So it's just the question of injecting the dermal filler in the right area, which is why we have three types of fillers. We have a very deep filler like an implant when we want to make the cheekbones, when we want to create that. There is a filler which is at the mid-level, which works on deeper lines and grooves. And the third filler is very superficial. So it works for hydration, it works for fine lines and wrinkles. So if injected in the right plane and the right product is chosen, you will just look very beautiful. It will take about 10 to 20 years off your face. Dermal fillers are avoided in patients who have uncontrolled diabetes, who have a history of carcinoma or are on chemotherapy, Patients who just recovered from a serious illness, we generally want to wait and then do it after 6 months. And also patients who are on aspirin or blood thinning agents for a very long time, we tend to, if we can, we stop the blood thinning agents for a while and then inject. The complications and risks post a dermal filler is infection. So if not injected in the right plane, if not taken care of the sepsis part of it during treatment, and generally if not given an antibiotic post the procedure, there could be signs of infection. There could be necrosis, that is, if an injection is gone into the blood vessel, there could be necrosis and burning of the skin in that area. Other than that, there are no side effects of dermal fillers. If done by the right doctor, it is just absolutely safe.